So I'm the training manager for Down Syndrome UK. Hold on a minute. And just a brief introduction to our charity and what we do in case this is your first webinar with us. Down Syndrome UK is a national Down syndrome charity. We have a healthcare kind of arm to our charity, which is Positive About Down Syndrome pads. We're in our 9th year, I think now, and within that, although we're in our infancy, I guess we've filled a lot of gaps actually in terms of supporting parents and professionals when it comes to having a baby with Down syndrome. We work very closely with the Royal College of Midwives, the Institute of Health Visitors, and we've done quite a bit of research into how women were given the news that their baby had Down syndrome, but also which has been published, and also we've done quite a lot of research into breastfeeding, which I'll go into as well a bit today. So our vision is very simple. It is a world where everyone with Down syndrome lives their best life. And currently there is quite a lot of negative stigma attached to Down syndrome, but it's something that we're trying to change, really, I suppose. So our forte, I think, is in championing the lived experience. So we talk to all of our family members of our community, and we use that lived experience to empower the parents themselves, to let them know that they're part of a really strong and supportive community. We use that lived experience to educate professionals. We use that lived experience to lobby policymakers. What I neglected to tell you actually in the first slide is that Nicola, our CEO, and myself are part of the National Down Syndrome Policy Group, which forms the secretariat to the APPG for Down syndrome. And we also champion the lived experience by enlightening the public. One of our roles really when the charity was set up was to fill the gaps that were missing in terms of supporting parents and families, and we've tried to make it more of a level playing field, making a lot of our services accessible online. So I think we don't just provide support, we do our training and campaigning, but things like Makaton training, quite difficult to source for some families, and counselling sometimes can take some time once the baby's been born. So we try to fill in a lot of gaps. Our families tell us where they're not being supported, and we try and pull in the experts and make sure that all families are supported in the way they want to be. Just to show you that we're a credible organisation, we do parent surveys every year, and thankfully year on year the statistics are going up, and we are a charity that families go to. They use and trust the advice that we give them. So we're a parent-led charity, and as such we consider ourselves to be experts through experience. So we understand the importance of relevant information and meaningful support. So we believe that every family who has a child with Down syndrome can access all of their healthcare services free from any discrimination or out-of-date attitudes surrounding Down syndrome. And we work very closely with hospitals, universities, any healthcare providers actually who need to know or would like to know more information about Down syndrome, and sharing that all-important lived experience. I think a lot of professionals we'll see families of children with Down syndrome and they go on their merry way, and perhaps you don't see them again, or you don't know how that experience was for them. So it's a great way of feeding back to professionals what parents what their experience was of healthcare generally surrounding their baby with Down syndrome. So what do parents worry about? These are really common themes, and certainly you could see at the beginning that I'm myself a parent of a teenager now actually with Down syndrome. I felt all of these things. So the common themes about what parents worry about: I don't want my other children to be burdened. What about the impact on my family? We have statistics show actually that siblings of children with Down syndrome are not adversely affected by a sibling of child with Down syndrome. It's not our statistics, but there are published statistics out there. Parents worry that their child will never fit in, they will live with us forever. They worry that they're going to have that eternal child, and it's not actually life with Down syndrome is not the same. Even 15 years ago when I had my son Billy, the work that I do with the National Down Syndrome Policy Group is with young adults with Down syndrome, and none of them want to live with their parents. I don't know why I thought that, a person with Down syndrome would be any different. But this generation of young adults with Down syndrome are striving to get those skills, those life skills, so that they don't get the interference from their parents or support workers, and they would like to live, with their friends, with their partners, get married and get a paid job, same as everybody else. And thankfully, more and more opportunities are out there for people with Down syndrome. Parents worry about, will we be able to cope with the extra pressures? Again, if you look into statistics, there are some really good qualities that come of being a parent of a child with Down syndrome, things like grown as a person, challenging ideas, understanding more about society. I can signpost you to these studies if you want me to. And also, families don't know where to get help in parenting a child with Down syndrome. I think a lot of families feel quite isolated, and they don't know where to go to get support. I run a local Down syndrome support group myself, and a lot of families will say, it's the unknown. They worry about the unknown. But I often say that it isn't the unknown. Down syndrome has been around for so long, and there's been so much research into their health needs, their educational needs, that it really isn't the unknown. It's actually the opposite. It's the known. And we're quite privileged that there is an awful lot of support out there, but it's making sure that you as professionals know where to signpost your families to. So as I've alluded to, children and adults with Down syndrome are now living longer. The life expectancy now of somebody with Down syndrome is 60 years and rising. And this is down to, many things. Improvements in healthcare obviously have made a real big difference to the life expectancy. As to, support opportunities, improvements in the quality of life has a knock-on effect on the life expectancy. And there's, like I said, there's been a lot of research into how children with Down syndrome learn and accessing early intervention programs like early speech and language therapy, early occupational therapy, early physiotherapy. And I know that in some boroughs and some areas of the country, these are not as available as others. And so we've developed our own online early intervention programs, and I'll go into that in a moment. So, many people with Down syndrome are leaving home, forming relationships and working. A lot of people with Down syndrome are now leading semi-independent or independent lives. Like I say, this generation of young people with Down syndrome, they're striving to live that independent life. So I would like you to think about your attitude surrounding Down syndrome and your understanding of what a life with Down syndrome is. And because parents will look for you for both, information and support surrounding their child with Down syndrome. And we don't want professionals to limit and dismiss what people with Down syndrome can achieve. And I would say that if you have an outdated attitude surrounding Down syndrome, or negative or low assumptions of what people with Down syndrome can achieve, you come hand in hand with a negative unconscious bias, and that affects the mental health of the families that you see. So as I mentioned at the beginning, we've done some research into how women were given the news that their baby had Down syndrome, at what point that was, and this is published data, and we found that a lot of families tell us that they didn't get support. 62% of them felt that they got no support surrounding Down syndrome, and 47% felt that they had no information surrounding Down syndrome. And sometimes that can obviously be, if they've had antenatal screening, that can be at a critical time where they're making decisions, really important decisions on whether they want to carry on with that pregnancy or not. So, we are all for, supporting a woman's choice, and it needs to be an informed decision when it comes to making those kind of decisions. And we would argue that unless women are given all of the information surrounding, Down syndrome, can you be sure that you're making a fully informed choice surrounding that pregnancy? So this is our latest round of research results. We call it University of Warwick University results, because we funded a PhD student at Warwick University, and she's just recently had 2 papers published surrounding the results that she got from her research. And you can see that in a lot of cases, when women are given that news that their baby has Down syndrome, it's done in a negative way. Obviously, positive manner would be great. Neutral manner obviously is the most accepted way, but a lot of them are still getting that news in a negative way. And like I said, that can have an effect on their mental health. So we've done two surveys with women about how they were given the news their baby had Down syndrome. And our latest round, which was the Warwick research, we decided we would ask them more in-depth questions about the effect on their mental health when they were given the news. And we found that only 34% felt they were given support antenatally, and that goes down to 26% postnatally. And if you compare that with the general population from the latest Maternity Quality Care Commission report, 85% of mothers felt that they were being supported. So there's a big disparity there, 85% to 26% if your baby has Down syndrome. And that lack of support is not just in maternity care. We also asked them questions. Did they feel they were supported when it came to breastfeeding their baby with Down syndrome? Constipation is a really big thing for us and our children, because as you know, our children are very likely to get constipation because of their poor muscle tone. But 57% of people surveyed felt that they didn't get any support surrounding the constipation of their child. And nystagmus again is another thing which is more common in children with Down syndrome, and nearly 50% felt they were getting enough support surrounding nystagmus. And also when we're talking about the effect on the mental health of our families, 37% felt the attitude of healthcare professionals had a negative impact on their mental well-being. And we have looked into, please feel free to take a look at this published research, or I can signpost you to the latest papers that have been published. But it's when we talk about the attitudes of healthcare professionals, often it's a very simple thing to do with language. It's about using positive language and thinking about, what the words you're actually saying to these families. So also in terms of paediatricians, we've asked our families, for a bit of feedback, and this is what they've come up with. I do get onto best practice, and the presentation does get more cheery later towards the end. But this is the feedback that we've had from families, that generally they felt that there was a lack of up-to-date awareness surrounding Down syndrome. There is an element of diagnostic shadowing that families are telling us, especially when it comes to things like breastfeeding, which, like I said, we've done quite a lot of research in, that families are told, mothers are told that perhaps their baby isn't breastfeeding because they have Down syndrome, and in fact they actually have a tongue tie. And in terms of constipation, some families are telling us that they're being told, well, your child has Down syndrome and they will become constipated, rather than treating the constipation, on a regular basis and giving families support surrounding that. So you have to think, well, I'm sure you do, what would be considered if they didn't have Down syndrome? Take Down syndrome out of the equation. Obviously, there are some health conditions that are more common in children with Down syndrome, but we found an element of diagnostic overshadowing. As I've already mentioned, think about the language you're using. Always use person first language. Don't talk about abnormalities in front of the parents, because it's their child you're talking about. And if you're talking about abnormalities, then you're calling their child abnormal. And I'm saying it as it is, but this is how parents are interpreting that language, and that, like I say, will affect their mental health. Don't talk about problems. These families will say that their child is not a problem, and don't talk about a disorder in terms of Down syndrome in front of families. Communication between healthcare professionals. Families are telling us that sometimes different departments are not communicating with each other, and that can have an impact on the parents, that they feel like they're chasing appointments from different healthcare professionals. Think about reasonable adjustments in your appointments. I know I'm asking for the moon, but we thought, well, if we don't ask, then maybe it might not happen. But families, if that child's main form of communication is through signing it in, especially in the early stages, because our children are visual learners, and I'm sure you know that they pick up signs really easy before that spoken language comes into effect. So if you are able to use Makaton in those early appointments, it would make a real difference. Easy read makes a difference to our families as well. Obviously, as the child gets older, talk to that person directly. Think about the learning disability team. A lot of our families, when they come to, they tell us that when they go to their hospital appointments, especially with older children, they didn't know that there was a learning disability team. I don't know how many people are within the learning disability team, and I don't think there's that many, but signpost your families to the learning disability team. Think about sensory and behavioural issues. And when it comes to blood tests, think about play therapists, and maybe some visual information surrounding blood tests would be really useful. Our families are also talking about continuity of carer and longer appointments. I know I did say I'll be asking for the moon, and I know you're overstretched as it is, but these are things that would really help our families. When it comes to language, think about the language that you're using. And I know from personal experience, but also, talking to our families, the words that you use will stay with them forever. I could easily recall some of the words that were used when I had my son, but parents replay these scenarios in their heads, and it can have like a downward spiral effect on their mental health. I mean, I'm sorry, I know this must be devastating news for you. This was a family who'd just been told that their baby had Down syndrome. They didn't know anything about Down syndrome, and this was their first experience of words surrounding Down syndrome. That the healthcare professional that imparted these words was sorry for them because their child had Down syndrome, and obviously having a child with Down syndrome is devastating. And I do understand that, nobody's intentionally trying to upset families, but you can see how that would upset somebody. Compared to congratulations, your baby is beautiful. They are all, the words that you use will, like I say, will be carried forward, and those good words get carried forward too. It starts someone, a really good journey surrounding their child with Down syndrome. Your child is beautiful, and they take that rather than does your baby look different to you, especially his eyes. I mean, this family said they didn't give me any leaflets and the neonatal unit. The doctor told me to look online for support groups, compared to, we think it's likely your baby has Down syndrome. There's a lot of support to help you with the family, and even a great support group nearby. So just knowing that there is a support group nearby makes a massive difference. So families know that there is support there for every aspect of bringing up a child with Down syndrome. And if you need to know if there is a support group near you, we have a list online, or get in contact with us and we'll find them for you. But we do have a list online of local support groups, which would be really helpful to families. So how, as paediatricians and healthcare professionals, how can you ensure that parents receive better care and support? The simplest thing, like I said in the beginning, although families may say that the attitudes of a healthcare professional may adversely affect them, it's really simply altered by making sure that you have a contemporary understanding of what Down syndrome is and what a life with Down syndrome is like in the 21st century. So by having a contemporary understanding and a positive outlook surrounding Down syndrome, it's very simple. You lessen that family stress and vastly improve their mental health. So it's more to do with having a positive outlook and a contemporary understanding surrounding Down syndrome. And as I've already mentioned, think about the language you're using. I mean, a lot of these are used in screening, actually. So we don't advocate the word risk when it comes to screening or pregnancy. Obviously, there are lots of different words that you can use instead of risk. Risk obviously is associated with peril and danger and terrible things. I've already mentioned, when you're talking to families, don't use these words. I mean, generally I put Billy in front of these words. My son Billy, is he an abnormality? Nope, he's my son. Is he a problem? He is a bit because he's a teenager, but that's not because he has Down syndrome. Is he a disorder? No, he's not. He's my child. He has a chromosome difference and a condition called Down syndrome. Now, that is not just me being over PC about this. It's sharing with you the lived experience of families that if you're going to talk about problems and disorders, you're going to, well, maybe those words will be taken with them extensively, and it may start a downward spiral in their mental health. So you're not breaking good news, bad news, or difficult news. You're sharing unexpected news, and it generally is unexpected news. You're not talking about normal babies. You're talking about typically developing babies, and always use person first language, as I mentioned previously. Now, I know a lot of conditions like autism, parents and families and people with autism like to be called autistic because it is part of them, and they are quite rightly proud of that part of them. And I don't know if it's perhaps our children, because our children, have the physical features of Down syndrome. For us, it's the opposite. If you're talking about Down's babies, we feel like you're dehumanizing our children. You're making them a syndrome before a person. So always, when it comes to Down syndrome, talk about babies with Down syndrome, children with Down syndrome. And if you do start your appointment with Down's babies, you're going to start making families perhaps not trust what you have to say, or they might get a bit prickly if you're going to talk about Down's babies. So always babies with Down syndrome. And when it comes to the importance of language, think about the clinic letters that you're having sent out. A lot of our families, this one is not an example. I tried to find an example, but I couldn't, my fingers. But a lot of clinic letters may say problems instead of diagnoses here. We do know that that is still occurring, and families will get in contact with us saying, they put problem Down syndrome. Now, is Down syndrome a problem to them? No, it's not. It's just how their child is. They have Down syndrome. It shouldn't be documented as a problem. So in this case, this letter is done good in the fact that it's talking about diagnoses. But, from a great start, it says, oh, my goodness, I put the name in there. So this is a young man who suffers with Down syndrome. So this is a recent addition to my talk. Sorry. It's just that a family got in contact with me with a clinic letter saying that it had in their clinic letter that their child suffers with Down syndrome. And that isn't the case. Children don't suffer with Down syndrome. A life with Down syndrome, obviously nowadays, it's not as it was in the 60s, and talking about suffering from Down syndrome is, quite outdated language. So what works well? So although I've just told you things about what doesn't work well, we're always really keen to celebrate and share good practice. So this is kind of a best practice kind of guide and a couple of additions, mainly shared from one family of who told us what worked well in terms of their paediatric service. So the good points and things that could be included in kind of good practice would be to be given the secretary's email so that contact can be made directly. The administration can be made directly. So if you have an issue with your appointment or anything you might need to follow up, you have a number who you can talk to directly. Making sure that all standard referrals are in place: eyes, ears, speech and language, portage, OT, physio. Like I said in the beginning, I do know that in some areas those referrals can take some time, and mainly, I think the things that we know that we have issues with are speech and language therapy, that our children have a known speech and language disorder. It comes with having Down syndrome. And we found that in some areas, there is a wait for that speech and language referral until they get to maybe 3, which is, for a typically developing child, that might be when concerns are raised. But for our children, early referrals are key to having success in their education and reaching their full potential and living their best life, which is what we have as our aim. So even if there is a speech and language shortage in your area, which I think there is nationally, if you get that speech and language referral in, they can start being on the waiting list right from the start. So, like I say, our children have a known speech and language disorder. There is no need to wait for that speech and language therapy referral. Physio as well is a bit of an issue we find in some places because some families say they get physio until their baby's able to walk, and then it drops off. But in an ideal world, it's not just about walking. As you know, our children have poor muscle tone, and it's about jumping, it's about stepping, it's about hopping and running. I mean, I know my son was one of those people that got discharged from physio quite early on, and he still has quite an immature gait, and I'm just wondering if he had more physio support, and our families will say the same, that things may be different and they could lead their best life. This is obviously with money no object, and therapists being available in an ideal world. Occupational therapy, again, we find can be a bit tricky to get hold of in some areas, and our children need occupational therapy is essential from, going through school. It's about dressing, it's about fine motor skills with handwriting. And we're finding that some families, there isn't any OT. They're not getting OT in those school years. And again, it's essential for them to reach their full potential to have a provision of occupational therapy in their EHCPs. So, to be offered a blood test every year for thyroid and second blood test if required, and making sure that there's a report that accompanies those blood tests. We find some families that they have their blood test and they don't know the results of those blood tests until they have their next paediatric appointment. Obviously, that if there was an issue, then they would know, but I think it's for the families to get that continuity and know how, things are progressing with their child, and the fact that they don't have to worry about thyroid function, and also they worry about slipping through the net, I think. So being aware of local support services from the third sector. A lot of charities do provide physiotherapy sessions, early interventions, often by local charities. And like I say, we as an organisation now have national online access to early interventions. Specialist speech and language therapy, as I've already mentioned, the speech and language disorder is specific to Down syndrome, and we need specialist speech and language therapists. And there are, many areas, specialist speech Down syndrome specialist SALTs. We want that in all areas, really, because it makes a massive difference that speech and language therapists are aware of that disorder. It's not simply a delay. As per NHS guidelines, a guaranteed sleep study at 2 years is recommended. To be willing to be involved in writing supportive letters for DLA, disability living allowance, and EHCP applications makes a real difference to our families. And if you are going to write a letter for supporting the DLA or the EHCP, it's not, you need to make sure that you're talking about the needs of that child, especially the disability living allowance. We found that some rejections of DLA have been just because some reports have been sent have been too positive, and pointing out, with this delightful child with Down syndrome who's very good at talking, or within the remit of having Down syndrome, but at the DLA and EHCPs they don't know about the remit of Down syndrome. So if this child is being really good within the remit of Down syndrome, they still need to have that support in place. So point out the child's needs rather than how well they're doing is really helpful to parents. Be reassuring and calming when parents are concerned with normal activity like teeth grinding, teeth and fingers in the mouth, sensory issues. The recommendation, again, to increase your workload, to write a full report after each meeting, because some of our families are saying that the report is not there, or it's just really brief. And with that report, to have at the end an indication of when the next appointment will be, or ideally have the next appointment in there, because especially in those early years, there can be an awful lot going on in terms of appointments, and some families don't know that they need an appointment, or they've missed an appointment, or they feel like they're chasing appointments. So if you can, ideally, to put an appointment at the end of any kind of consultation letter. And something else, and making sure there's a smooth transition into adult services, and parents are aware what to expect in the next phase of their child's development would be really useful. So PADS, Positive About Down Syndrome, like I say, is our healthcare arm of the organisation Down Syndrome UK. So we have a whole load of support networks available to families. So we have Great Expectations, which is for pregnant women. We have one for expectant dads as well. So whether they've had a screening result or definitive diagnosis, parents have told us that that was the right place for them to be at that time. And from there, they will go on to the new parents, where the support is obviously geared up towards 0 to 18 months, moving up to preschool parents. And because we've been going long enough now, we now have a primary school group, and we're looking into secondary school as well. But we have a whole range of publications which are available online, but also if they join our Great Expectations group or the new parents group, they get a copy of Nobody Told Me book, which we found is we've had really good feedback from families as well as professionals. It's not a sugar-coated book, but it is about lived experiences of people, parents, not just parents, but siblings of people with Down syndrome, grandparents. We don't like to exclude the grandparents in our charity, but also people who work with people with Down syndrome, and the expectations and aspirations of young people themselves with Down syndrome at the end, which we've had really good feedback from that. The Little Orange Book of Knowledge is like a postnatal guide for families. Again, this can be accessed online, but we often give these out to support groups. And it has things in there like when should they see their paediatrician, what referrals should they get, things like teeth come very late in children with Down syndrome, and it explains those kind of things that they may not have thought about that may cause them worry. You know, if their child is over 1 and they still don't have any teeth, then they're going to worry. So we kind of try and alleviate that family stress, but it's also got about benefits advice in there. And again, we're really proud of that book. So we've done we found that there was a lack of support surrounding heart surgery. So we have a lived experience heart surgery leaflet, and again, breastfeeding, like I say, is something that we've done a lot of work into. The Heart Buddy scheme is unique to us. I think before our charity, talking to our community, they were telling us that there was a real lack of support when it came to heart surgery. So we now have a Heart Buddy scheme where we pair up families of children having a particular type of heart surgery at a particular hospital, so they can have that both that practical and emotional support in that really difficult time, and that's working really well. And we have a Down syndrome specialist coordinator who's also written a guide, but she also does information sessions and online support to families, to mothers who want to breastfeed their baby. So like I've said, there's an assumption that babies with Down syndrome can't breastfeed, and that we've done several surveys now, and still that assumption is still there. And we're also working on NG tube advice, because our families are telling us that a lot of their children are leaving hospitals with NG tubes in situ without a care plan as to how to get them back onto oral feeds, and support there. So that's something that we're working on. As I mentioned, we try to make things more of an even playing field, wherever you live in the country. So we have a really good physiotherapy group. We have a great physiotherapist who's also a parent, who has some really good insights on how best to support families, children with Down syndrome. So families are able to access that online. And we have our early development groups, which involve early speech and language skills, memory skills, literacy and numeracy skills that they can access online. They have to sign up to these groups, but they are really popular if they're not available in their area. We're also really proud of our Pants for School programme. Families were telling us that they weren't getting support when it came to toilet training their child. And they're told that they're, not to bother toilet training them. Oh, it's a very difficult word to say, toilet training them until, they're older, maybe 5 or 6 or 7, because they wouldn't be able to understand the, toilet training. But it's actually the opposite. I was one of those families, actually, and we went through toilet training hell for many years. It's not actually, don't start them, start them early. It's the opposite. Start them as early as they can sit, make them aware of, the potty and what's involved in toileting. And then as they, once they've started that, we have a toilet training boot camp. So families, if they've started actively taking away the nappy, they can join our boot camp, which I think is over a month, just to make sure they don't give up, that they carry on, that they can support each other. But our toilet training program was developed with the national charity Bladder and Bowel UK, Bladder and Bowel UK. Cool, this slide's very difficult to get past. And we have a specialist incontinence nurse on the team who can provide support, and they do information sharing sessions surrounding toilet training. And we're finding that thanks to Pants for School, which is exactly what it says in the tin, getting our children into pants ready for school, that our children with Down syndrome are now being toilet trained alongside their mainstream peers. I mean, it is a commitment, but it's our families are saying that it's a game changer and a lifesaver for them. So we also provide a bit of specialist support, practical support. This is surrounding Hirschsprungs as well, NG tube feeding, I've already mentioned. Infantile spasms and constipation is a really big thing for us, but that's just the tip of the iceberg surrounding the support that we're able to offer. As I mentioned in the beginning, Nystagmus was an area where there was a lack of support. So we have a guide surrounding that, but also we've enrolled the support of Maggie Woodhouse, who's in Cardiff. She was the only Down syndrome visual specialist, and we found a lot of our families were hoofing it over to Cardiff, wherever they lived in the country. And we now, like I say, made it more even playing field, and we have access to Maggie's expertise online, and she does information sharing sessions for us as well. Primary schools and nurseries and the school support that we're able to offer is now ramped up now that we've been going for a number of years. So we are able to support families in how to choose a nursery, what's important in choosing primary school. We provide EHCP support and DLA support specifically for children with Down syndrome, but we also now have a primary education program that we're hoping that schools will buy into, and making sure that our children are educated according to their unique Down syndrome learning profile. We also provide bereavement support if, unfortunately, the pregnancy doesn't work out, or they lose their child with Down syndrome. So again, we're putting people together, Down syndrome specific, and we provide counselling if needed. So there's all these QR codes that are available on our website. So do take a look on how you can find out how best to support and signpost your families in terms of having a baby with Down syndrome. But we feel like we're covering most angles at this point. So in summary, because I do really want to make sure we have time for discussion, think about your language and how that can have an impact on parents may feel about their baby and bonding with their child and their baby. Please don't be sorry, and there's no need to constantly refer to Down syndrome. They know their child has Down syndrome, and if it's being constantly referred to, it can affect them. Have a contemporary understanding of Down syndrome. Don't assume parents know a lot about Down syndrome. Some may know very little, depending on what point you see them, obviously, and some may be given the information, but they haven't looked at it yet. So have high expectations of what people with Down syndrome can achieve. Don't assume that they won't reach their milestones. Generally they do, but they take their time. See the individual and don't generalize. I know our families are sometimes saying that they might say that they're always loving, and we have a child with Down syndrome, it works, a person with Down syndrome works in Asda. Those kind of informations and comments might seem to be comforting, but then they're not necessary, and sometimes they are they have the opposite effect. Be aware of diagnostic overshadowing. So in terms of our organisation, we deliver a more extended version of this training. It's CPD accredited to healthcare professionals. So do get in contact if you think that's something that your department might be interested in. And we can tailor it to your timeframes as well, if necessary. If you just want a very small introduction, as part of an interdepartmental meeting, do get in contact, because we can tailor it to any kind of timeframes that you have. So we also have, talking about closed groups that we have for families, we also have one for healthcare professionals. And also on our website, we have a professionals section that you can get in contact if you want any information about any particular area surrounding the patients that you see. But also our training offer will be on there as well. We have, like, you know, lunchtime webinars. We have a whole range of topics that we cover, and next year I think we're talking about the importance of language, and we have our breastfeeding webinar is going to be scheduled for January.